Hello everybody. This session is about anterior triangle of neck. The objectives are, at the end of this session, you'll be knowing about the boundaries of anterior triangle, subdivisions of anterior triangle, boundaries and content of each triangle, and the clinical anatomy. And at the end of this session, the few questions will be given related to this topic. The anterior triangle, it is bounded medially by the median line and laterally by the anterior border of the sternocleidomastoid muscle. The boundaries of the anterior triangle includes medially, it is bounded by the anterior median plane of the neck, laterally by the anterior border of the sternocleidomastoid muscle, superiorly by the base of the mandible and the line joining the angle of the mandible to the mastoid process. The roof is formed by the skin, the subcutaneous tissues containing the platysma. The digastric muscle and the superior belly of omohyoid muscle divides this anterior triangle into four smaller triangles. Those are the submental triangle, the submandibular triangle, the carotid triangle, and the muscular triangle. So one by one we'll discuss about each triangle. The submental triangle, it is situated between the chin and the hyoid bone. The apex is situated at the symphysis minti. The base is formed by the hyoid bone. It is bounded laterally by the right and left anterior bellies of the digastric muscles. Inferiorly, it is bounded by the body of the hyoid bone. The floor is formed by the two mylohyoid muscles and connected by the membrane between these two muscles. The contents, the small submental lymph nodes, which drains the superficial tissue below the chin, central part of the lower lip, the adjoining gums, anterior part of the floor of the mouth and the tip of the tongue. All these finally drains into the submandibular nodes. Another content of this triangle is anterior jugular vein. Next triangle is digastric triangle. It is situated between the anterior and the posterior bellies of the digastric muscle. It is bounded antero-inferiorly by the anterior belly of digastric, posterior-inferiorly by the posterior belly of digastric and the stylohyoid muscle. The superior or the base is formed by the base of the mandible and the line joining the angle of the mandible to the mastoid process. The roof is formed by the skin, the superficial fascia and the deep fascia. The floor is formed by the mylohyoid, hyoglossus, the middle constrictor of the pharynx. The contents of the digastric triangle can be divided into the contents in the anterior part of the triangle and the contents in the posterior part of the triangle. Again, in the anterior part of the triangle, the structures which are superficial to the mylohyoid includes the superficial part of submandibular salivary gland, the facial vein, the submandibular lymph nodes and the facial artery. The structures superficial to the hyoglossus muscle, the submandibular salivary gland, the intermediate tendon of the digastric, the hypoglossal nerve. In the posterior part of the triangle, again it is subdivided into the superficial structures, deep structures and the deeper structures. So in the superficial structure, it includes the lower part of the parotid gland, the external carotid artery before it enters into the parotid gland, and in the deep structures, it includes the styloglossus, stylopharyngeus, glossopharyngeal nerve, the pharyngeal branch of the vagus nerve and the styloid process. The part of the parotid gland is also present in the deep structures. The deepest structures includes the internal carotid artery, internal jugular vein and the vagus nerve. Carotid triangle. So the common carotid artery, internal and external carotid artery is present in this triangle. It is bounded anterosuperiorly by the posterior belly of digastric and the stylohyoid muscle. Anteroinferiorly, it is bounded by superior belly of omohyoid. Posteriorly, it is bounded by the anterior border of the sternocleidomastoid muscle. The roof is formed by the skin, superficial fascia, that includes the platysma, the cervical branch of the facial nerve, the transverse cutaneous nerve, and the investing layer of deep cervical fascia also forms the roof. The floor, it is formed by middle constrictor of the pharynx, the inferior constrictor of the pharynx, and the thyrohyoid membrane that will be present between the thyroid cartilage and the hyoid bone. The content of the carotid triangle, it includes the arteries, veins, nerves and the lymph nodes. The arteries includes the common carotid artery with carotid sinus and carotid body at its termination, the internal carotid artery and the external carotid artery. The few branches of external carotid artery also present in this triangle. Those includes the superior thyroid artery, lingual artery, facial artery, the occipital artery and the ascending pharyngeal artery. The veins includes the internal jugular vein, common facial vein, pharyngeal vein and the lingual vein. The nerves includes vagus, superior laryngeal nerve, which will give rise to the internal laryngeal nerve and the external laryngeal nerve, the spinal accessory nerve, the hypoglossal nerve and the cervical sympathetic chain. Carotid sheath. It is nothing but a tubular investment of the deep cervical fascia. It encloses the common carotid artery, the internal carotid artery, the internal jugular vein and the vagus nerve. The artery lies medially, the vein laterally, and in between these two the vagus nerve is present. It is having anterior and the posterior walls. The anterior wall is formed by the pretracheal fascia and the posterior wall is formed by prevertebral fascia. The relations of this carotid sheath: anteriorly it is related to the ANSA cervicalis. The ANSA cervicalis is embedded to the anterior wall, whereas the posterior wall is related to the cervical sympathetic chain. Carotid sinus. It is nothing but a fusiform dilatation involving the bifurcation of common carotid artery and the internal carotid artery. That is, the beginning part will be having a dilatation. So here the wall of the artery is thinner and more elastic. It receives the sinus branch from the glossopharyngeal nerve, the vagus nerve and also from the sympathetic trunk. It acts as a baroreceptor and it controls the intracranial blood pressure. The stimulation of the carotid sinus produces the reflex fall of the blood pressure and slowing of heart. So now carotid body. It is a small reddish brown ovoid mass of tissue. It lies on the medial side of bifurcation of the common carotid artery in close relation to the carotid sinus. It is supplied by 9th and 10th cranial nerves. It acts as a chemoreceptor, whereas the carotid sinus acts as the baroreceptors. So it monitors the level of oxygen in the blood. Next Next is the muscular triangle. Here mainly the muscles, that is the infrahyoid muscles, are present in this triangle. It is bounded anteriorly by the anterior median line of the neck extending from hyoid bone to suprasternal notch. Posterior-superiorly, it is bounded by superior belly of omohyoid. Posterior-inferiorly, it is bounded by lower part of the sternocleidomastoid muscle. The contents, it is mainly the muscles, that is infrahyoid muscles, that includes sternohyoid, sternothyroid, thyrohyoid and the homohyoid. These muscles also forms the floor of this triangle. ANSA cervicalis. So ANSA cervicalis is nothing but a thin nerve loop closely embedded to the anterior wall of the carotid sheath. It is having the superior root, inferior root and the ANSA, which will be connecting these two roots. It is formed by the superior root, that is the descendens hypoglossae, which carries the fibers from C1, and the inferior root or descendens cervicalis, it carries the fibers from C2 and C3. It winds around the internal jugular vein, and the loop, also known as the ANSA, it lies in front of the carotid sheath at the level of C6 vertebra. It supplies the infrahyoid muscles, that is sternohyoid, sternothyroid, inferior belly of omohyoid and superior belly of homohyoid. Coming to the clinical anatomy, the carotid sinus syndrome. So in some individuals, they will be having the hypersensitive sinus because of unknown etiology. So such persons, when they turn their head towards one side suddenly, there will be a sudden attacks of syncope and the slowing of the heartbeat. In the supraventricular tachycardia, it can be controlled by the carotid sinus massage due to the inhibitory effects of the vagus nerve on the heart. Potato tumor, it's a rare feature. It is produced by the enlargement of the carotid body. So here the tumor moves transversely and it shows the transmitted pulsations, and it is associated with the slow pulse and attacks of fainting because it will be giving the pressure on the carotid sinus. These are the few clinical anatomy related to this. So that completes the anterior triangle of the neck. And the questions frequently asked here, they may ask the boundaries and contents of any triangles. The long essays, they may ask as describe carotid triangle under following headings: the boundaries, the floor, arteries and nerves, or the boundaries and contents of carotid triangle. The short essay or the short answers includes the digastric triangle, boundaries and contents, submental triangle, boundaries and contents, boundaries of muscular triangle of neck, carotid sinus, carotid body, ANSA cervicalis, formation, labeled diagram and distribution.